Which of the following does not occur as a pathological response to extensive burn? That means in case of the extensive burn, which usually not occurs, or which event not happen. Here the options are the plasma leakage into the interstitium, absolute polycythemia, increased hematocrit, keratinocyte migration during healing, and cardiac output reduction by 50% in the past 30 minutes. So which will not occur? So let's see the burn physiology. In case of the burn, hemolysis occurs due to damage of the erythrocyte by heat and microangiopathy. So what happened? First of all, there are different type of activity occurs, among them hemolysis, that means the blood cell breakdown, and blood cell breakdown especially the erythrocyte by the heat, as there is excess heat, so RBC broken down. And also the microangiopathy, that means the disease of the microvasculation due to burn. And we know the normal shape of RBC is normal size is about 7 to 8 micrometer. So when pathology occurs in blood vessel, this shape is not maintained and finally broken down. Loss of capillary membrane integrity and causes the plasma leakage in the interstitial space. So what happened in case of the burn? In case of the burn, what happened? Like this is a blood vessel and this is the endothelium. So when there is burn occurs, in this condition, what happens? In this condition, this endothelium loss. When the endothelium loss, then what happen? The blood circulating, it will goes into the interstitial space. The extravasation of the fluid from the burn site causing hypovolemic shock. As the fluid goes outside the blood vessel, so hypovolemic shock develop. In this condition, hypovolemic shock develop. And up to the 48 hours of the injury, decrease blood volume and increase hematocrit. Actually, we lose here the plasma, not the blood cell. So plasma is loss, but in the blood vessel there is concentration of the blood cell, but there is less amount of the plasma or fluid. In this condition, hematocrit level is increased. Also the protein loss, because we know the protein, albumin, globulin, fibrinogen, prothrombin, and other plasma protein like different type of the protein, they also lost in the interstitial space. And secondary infection usually done by Staphylococcus aureus, Pseudomonas, and other pathogens. So what may develop? The ARDS, which is the what is ARDS? ARDS is the adult respiratory or acute respiratory distress syndrome, or adult respiratory distress syndrome may develop. Also there is a risk of curling ulcer. So what is curling ulcer? It is peptic ulcer disease due to the burn, because due to the burn there are also ischemia in the stomach, and as there is ischemia there is less amount of the blood and final peptic ulcer develop. In case of danger, in case of the full thickness circumferential burn, in case of extremity there is formation of the eschar. So in this condition escharatomy develop. Escharatomy should be required because there is chance of development of the compartment syndrome. So to prevent the compartment syndrome, we should go for the escharatomy in case of burn. And what is the healing procedure? In case of the healing procedure, in superficial burn, keratinocyte migrate to form the new layer in the burn site. In case of full thickness burn, there is the dermal scarring. Usually need keratinocyte from the skin graft to provide optimal coverage. So which does not occur? This is the absolute polycythemia. Here present polycythemia, but it present due to fluid loss. So when fluid loss, a smaller amount fluid, there is a high amount of RBC. So in this condition, polycythemia, it is the not absolute polycythemia, it is a relative polycythemia. And the plasma leakage in the interstitial space, it is true. Increased hematocrit, it is also true. Keratinocyte migration during healing, it is also true. Cardiac output reduction 50% in the past 50 minutes, it is also true, because the cardiac output has the blood volume loss, so cardiac output also